Good morning, this is Dr. Stewart from Timonium Foot and Ankle Center. I have a patient here, Harry. Harry, good to see you.
Hi, Dr. Stewart.
Hi. So Harry's been a patient for ours for a long time, and we are now in the beginning of September, and I'm happy to say Harry's doing excellent. It's taken a few months for him to do well. Harry came in and he was having a lot of pain on the inside of his foot and ankle. He had a lot of pain over what's called the posterior tibial tendon, and he had a lot of pain in his plantar fascia. Prior to coming to see me, Harry was hoping for kind of a quick fix, right?
Yes.
Okay. And you went into a retail store, correct?
Correct.
So what did the retail store provide for you?
An over-the-counter orthotic.
Orthotic. And so what Harry did was he went to a retail store and he bought something like this, okay? And this is just an over-the-counter piece of plastic material. Did you spend a lot of money on this?
About $1,500.
$1,500. So this is $1,500. Did it help you?
Very little.
Very little. So this is just an example where we need to understand that if you're seeing, there's been a run lately, we're seeing a lot of patients going to retail stores hoping for really good pain relief, spending a lot of money, and unfortunately, they're just not achieving the results that they want. That's because foot and ankle conditions really require a true medical treatment. So Harry came in, we identified his problem. I explained to you that you had tendonitis. I explained to you that you had plantar fasciitis. And we basically put him in an ankle brace for several weeks. We had him use a splint, and we actually did laser therapy. How did you find the laser therapy helped you?
Very, very much.
Very much. Harry did a bunch of lasers. He actually did 10 treatments, had a lot of improvement, and actually added 5 more. How's your pain at this point?
95% better.
95% better. The other thing we did for Harry was we made him an orthotic that was actually customized to his foot. I just want you to come over here and see the difference. So these are some of the over-the-counter devices, and you can see the big difference in that the over-the-counter devices, they don't really have a heel. They have a very shallow heel. This has an extremely aggressive arch. They're very flexible, okay? Extremely flexible. The body weight can bend these, okay? And this is the custom device, and you can see it's not moving. And a big part of getting the foot better is to contour the orthotic to the foot properly. This was made off a 3-dimensional custom mold of his foot. This is supporting his foot, and this is not allowing his foot to come down, whereas something like this, excuse me, will allow his foot to roll right over. You can see the heel is not, he's gonna roll over that. This also has a lot more flexibility. You can see how flexible this is. This is just a piece of plastic material. So unfortunately, you cannot achieve the proper results of treating a foot and ankle condition solely with this. And I want to emphasize that he was treated for several weeks with other therapies before we even introduced the orthotic. The orthotic is not the device that will get him better. The bracing, the laser therapy, the night splint, Harry's lost a lot of weight. He's done an excellent job, and this is what's gotten better. How is this orthotic helping you?
Supporting my foot much better.
Okay, and you're using it regularly?
Every day.
Okay, and we've also paired it with the proper shoes. So this is an example of how we need to do a comprehensive medical treatment. When we treat foot and ankle conditions, we need to do comprehensive care. The comprehensive care is including orthotics, okay? And this is why we really encourage custom devices, okay? So, Harry, we thank you for sharing your experience and your story. We thank you for trusting us. You did very well with the laser. You're 95% better. We appreciate it, and we appreciate everybody listening today. If you would like to learn more about foot and ankle conditions, feel free to call us at 410-560-2777. Thank you.